Welcome to the Multicultural Media Online Conference. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for these sessions. Good afternoon and welcome. And we are so pleased that you've joined us. Today, we're hosted by the Ministry of Health, the Multicultural Health Communication Service, with the support of Multicultural New South Wales. And today we're pleased to have with us Dr. Anju Aggarwal, a GP who works in Southwest Sydney. And welcome, and it's nice to see you, Anju.
Thank you, Jess. Thanks for having us.
Thank you. And Megan Cobcroft, who is the Director of Prevention Programs in the Centre of Population Health here at the Ministry of Health, has also joined us. Thank you so much, Megan.
Thank you.
And our focus for today's forum is on some of the most important members of the community, the seniors, and what we can do and they can do to protect themselves and their loved ones from respiratory illness, given the high levels of viruses circulating in our community at the moment. We're also looking at all the different ways older people can stay active and also what programs and resources are available to them. And we'd also like to talk about carers who are supporting the seniors and people who in the families who are also living with seniors. And before we start, I'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and pay respects to our Aboriginal colleagues who may be joining us in this session today. We also pay respects to multicultural communities and refugee communities that are represented in this forum. And so we'll start with all the questions. Please add your questions on the chat. We have 30 minutes and Dr. Anju and Megan will be able to answer your questions. And it's a really important topic. We know that seniors and healthy aging is important. And given the weather right now, it's so cold, what do you do to protect yourself? So some people are at higher risk of severe illnesses, including seniors. Can you tell us more about that, Dr. Anju? And you worked with a lot of seniors in your job.
Absolutely. Jess, it is flu season, but it's not just influenza. There have been multiple viruses and bacteria going around at the moment. It wouldn't be too dramatic if I say there are like truckloads of respiratory conditions. And seniors are more at risk because many of them have other chronic medical conditions, diabetes, asthma, decreased immunity, or others. So the most common viruses and infections, the ones we are seeing at the moment, is influenza, RSV, COVID-19. So COVID and influenza, they have been for a while, like especially COVID, but more and more of influenza. And the other infection we are also seeing in kids and adults is the mycoplasma. So these are the infections. RSV is sort of stabilized now, but influenza is still in abundance.
So COVID-19, it seems so, we hear it, it's still there, and RSV and the flu. At some point, there was this time when we didn't have the flu and we didn't have RSV, but because people are around.
COVID-19 has become like a friend who never leaves. I don't know when will they leave us now. But there was a period when the respiratory illnesses it appeared that we are out of it, but they've gone up again. Multiple reasons, because we started mixing up, we stopped using the common health hygiene, we started more partying, hugging each other. So, and also the season, the influenza season. So it's a combination of things why they are on the up again.
What can seniors do to protect themselves?
Multiple things. So to start with, let's go back to the COVID times. So simple hand hygiene, wash your hands. If you are sick, then stay home, use the protection, use mask. Have your vaccination. That's one of the most important messages. I'll take this opportunity to talk to our seniors that make sure you're vaccinated. It's very, very simple. You can go to your GP, you can go to the pharmacy, and get your influenza vaccine done. Protect yourself if you can. And that's one of the most important messages. Do get your vaccination ASAP.
And this is not even when you're feeling, it is important, especially when you're feeling well, you should be doing that.
Do it when you're well. Yeah, you don't want to have influenza and face the music. So do it when you're well. It's very simple, very easy, almost has no side effects.
Now, Megan, it's really important for older adults to be healthy, to keep fit, and that doesn't mean older people, but ourselves. That's the rule for everyone. Why is this important? Why is it important for us to make sure that we're physically active?
You know, it's I would say that staying active is one of, if not the most important thing you can do as you get older to maintain your quality of life and just your general well-being. And that's because it's really important for balance and prevention of falls, which is a real issue for older adults. Also helps with concentration, energy, and just your mood and overall well-being as well. So it really has a big impact on your life, and the evidence is pretty strong about physical activity being really important.
And what services are available for adults and seniors and adults?
Yeah, we have a number of services available. So the recommendation for adults is to do 30 minutes of exercise on most days of the week for older adults. And if you haven't exercised before, I would say, don't worry, even if you do a small amount, it's going to make a difference to your health, even if it's not the 30 minutes. So ways to do that, we have an active and healthy directory, and you can go onto that directory. You can type in your location. You can even choose how far away you want to travel, and you can find some local exercise classes there, anything from Tai Chi to walking groups to yoga. And if you don't want to leave home, if you want to do something at your own pace and in the comfort of your own home, there are also videos you can download to help you pace yourself and do some exercise in the comfort of your home.
And that's right. There are a lot of videos available. There's so much, but these are free.
They're free, that's right. And look, they're equally important for the carers and the older adult that you may be caring for. So it's about choice, and there's lots of choices out there for people to be able to select something that works for them, noting that not everyone likes to do the same activity type. Yeah.
Yeah, no, I try to do 30 minutes on most days, on some days. And it does make a difference, doesn't it? And that would be probably your recommendation to your patients as well.
Absolutely, without a doubt. The science now is about quality of life, and the second is preventing more than treating. It's obviously both treating and preventing, but we are moving to a century, and when prevention, we look more forward than treating. So if you are diabetic, we make sure that you don't have any end organ damage, and your quality is improved. If you're not diabetic, you are just weight is an issue, then we do things so that you don't become diabetic. So it's all about preventing, and that's where vaccinations come. So preventing the illness, because if you can prevent, why have the illness? So, and it can be prevented by simple lifestyle measures, walking, eating healthy, and looking after yourself, having your vaccinations.
Yes. And Dr. Anju, we talked about, Megan, you talked about falls as well. And this is an issue for older people. It's an issue for me sometimes when you lose your balance. What can we do to ensure that we're keeping in shape and taking care of older people and ourselves with the falls?
Falls in elderly is a very serious and important topic. Multiple things to help prevent the fall. To start with, make sure the house is equipped in the right way. There are no loose mats and things on the floor, which they can trip, number one. Number two, never rush for anything. That's so important in elderly. If there is a phone call or if there is anything, do not rush. Someone who is ringing you will ring again. Often my patients, they had a fall because they're rushing for the phone and slipped or something. So simple things can help not falling. Make sure, you have good balance. If you need a stick, use the stick. But in the bathroom, make sure it's not slippery. And you have a chair somewhere where you need those things. So that's preventing fall. And then also along with prevention of falls, it's important that they're taking good calcium, good vitamin D, so their bones are strong. So even if they do have a fall, there's no fracture. So the purpose is to prevent falls, but if there is a fall, there's no fracture. If there is a balance issue, there are balance clinics where they can go. The GP can do the referral, which help them improving their balance.
Thank you. I want to go back to keeping yourself healthy. You said diabetes. There's also other sicknesses that you can get vaccination. That's why we're encouraging vaccination. Going back to influenza, immunocompromised individuals who are over 65, it is essential for them to get the vaccinations.
All the more important for people who are immunocompromised to get all their vaccines, depending on what age group and what bracket they are. Obviously, there is influenza vaccine, there is COVID vaccine, and they may even be eligible for pneumonia, shingles. So there are multiple vaccines which they can do to prevent the illnesses, and they're really, really important and useful. Yeah.
And these vaccines help you to get better, preventing other illnesses and falls as well. Now, we'd like to watch this video from a community advocate and community leader, Sue Advani, who's encouraging everyone from over 65 to get vaccinated. Watch this.
My name is Sue Advani. I am an immunocompromised person. Every year, I do get my flu vaccination, and I make sure that my husband gets it as well. It is very important, particularly because of my immunocompromised situation and the fact that I really don't want to get into a situation where I ended up in ICU. I would rather not. So prevention is better than cure. Getting the flu vaccination is quite quick and easy. It's very, very important for us to get a flu vaccination, our age group, 65, immunocompromised, grandparent. We don't want to pass on our own flu situations to our family and friends. And we also don't want our family and friends to give us the flu and make things worse for myself. Getting the flu vaccination is the best way to protect myself and my family.
Yes,
That's the best way.
that's the best. And thank you, Sue Advani, for that video and for sharing your story. And that is important, where you are also showing being an example to others.
I had my flu vaccine. So, yes, it is important. We all, need it, and it's important we do it to stay healthy, happy for ourselves and our family.
Megan, with your work in health promotion, this is crucial to being able to reach communities and yes, you're trying to tap into the seniors and for healthy aging, but you're tapping into the people who take care of them.
No, absolutely. We absolutely acknowledge how important the carers are for looking after our seniors, and we want to make sure they're well as well. So we have a few options actually for carers and seniors. So we operate a Get Healthy coaching service, and that's a virtual service, and it operates 5 days a week. And so you can ring when you want to ring, or you can join by video conference, just to work around when you're available. And what it does is it provides you with some personalised one-to-one coaching by qualified health coaches, and they help you to make some healthy lifestyle changes. So you may be struggling as a carer to eat well and to exercise because you've got so many commitments, or you may be wondering what to do for the senior person you're looking after. So the personalised coach, they tend to be dietitians or exercise physiologists. They can help you agree what you'd like to achieve, help overcome some of those barriers, and really support you to make the changes you need to make and when you need to make them as well.
And the programs for falls, there are programs to.
There are, look, and I think, we were talking about 1 in 3 adults over 65 have had a fall in the past year, and really acknowledge the impact that has on the person who's had the fall, but those who care for them as well. It's a massive impact on quality of life. So in that active and healthy directory I talked about, there's 1,000 choices of programs in there you can join up locally. And there's a special section you can look at for falls prevention programs, which really focus on strength and balance. And we do know that for people, it's often a lack of confidence when you've had a fall about getting back on your feet again. And so go and check out some of these programs. Some of them are run locally, some of them are online, and you can get your confidence back to start moving again and feel more confident about falls prevention. We also have a booklet called Staying Active and On Your Feet, and it's also available in 6 languages, which really speaks to some of the small steps you can take at home as well to prevent falls.
Thank you. And if you have any questions, please put them under chat. You can see that our colleagues from the Multicultural Health Communication Service are putting links onto the chat. I'd like to ask you both. Now, if you wanted to start a program, a healthy, a new program into getting healthy and active, it is important to check with the GP before you get started.
Look, yes, absolutely. It's important to check with the GP so that if there is any precaution you need to use or any specific guidance, what is available, what is your extent, just discuss and it's more useful so that you can do the right thing. Yeah.
And that's what you've been.
Yeah, totally. And I think the addition to that, I'd say start small. So some people feel like they've got to do that full 30 minutes a day, most days from day one. But actually, we know that making very small changes can actually have a big improvement to your health. So start small so you can maintain it and build from there would be my recommendation.
And maybe gather some friends. Would that be nice? Because then you don't even know that it's 30 minutes.
Yeah, I mean, healthy eating and being more active is something you can do socially, and we would really encourage that. Yeah.
Adding to Megan, I tell my patients a 5-minute rule. So 5-minute rule is, doesn't matter how busy you are. In 24 hours, 5 minutes is like less than 100th. So make sure you have at least 5 minutes for yourself a day. And that 5 minute, you just tell yourself, okay, I just want to go around the block and then come back if I'm really, really busy. And you'll find that 5 minutes becomes 15 and a half an hour without your effort.
Wow.
So 5 minutes every day, make that as a rule.
That's a good one. 5 minutes every day, but it's actually 30 minutes. So
yes.
that could turn into 15.
It does turn.
Yeah.
The other thing I was going to say is you don't need special equipment either, do you? So sometimes people feel like, even say with falls prevention, you need something to help you with balance and strength. But these exercises you can do at home in a chair. They're things like walking outside. You don't need special equipment to make that difference.
Yes. And, those links are on the chat, and there's some new messages there. You've got the links. And I guess it's just doing what you enjoy, isn't it?
Absolutely. Or you won't keep doing it, will you?
Yes.
Yeah.
Pleasure and activity go together.
But, Dr. Anju, with your work with the seniors and with the communities, there are a lot of community organizations across New South Wales that are multicultural, that are activity-based. So I think there is, as you say, there's a lot of things out there if you go look for it, but sometimes it's just very difficult. What should you do if you need that kind of support in terms of finding those services?
So again, I'd send people to that active and healthy directory. So 1,000 local programs to choose from there, and people are adding more every day as well. What we also, as part of our coaching service, which is also, we have a number of bilingual coaches. They operate all around New South Wales. They also have some great information on what's available locally as well, and can really help you with some local tips and how to kind of get in contact with local organisations. But through your local networks and the communities you have, I'm sure word of mouth and will also get you a long way.
And sometimes the local councils have these
activities. They do, yeah.
Every area has a list of community services which can be used. So talk to your GP, they'll give you the list of community services in your area, the social groups which you can be part of it, the one which that suits you.
Dr. Anju, there are resources available. You've been part of the video in terms of developing resources and doing that in language. How important is it to reach communities with information in language?
It's really useful in different languages, and most of the information is in multiple languages. So there is no issue of unable to understand. So there is interpretation in various languages. And with the health, there is also Health Direct line. So anyone who needs a health question, if it's not urgent, you can ring Health Direct. And within the Health Direct, there is also the interpreter service. If they need, that can be part of it as well. So we'll send the links for that. So those are available.
And that's right, with Health Direct, you can call, and so that you can find out if your issue is urgent and whether you can be directed. You can nurse, and if you need language support, there are interpreting service 131450, and ask to be connected to Health Direct. Because most of the time, the emergencies are actually, it is better to find out if your issue is urgent, and that's by talking to the nurse in Health Direct.
That's right. Yeah. So they can direct you whether they need to go to emergency, or they can see their GP tomorrow, or they can wait for a couple of days. So at least, you have some guidance.
Yes. Megan, with your work in health promotion, what is the most challenging and what's most exciting as well?
Yeah, I think the most challenging is probably, it's all about changing behaviours sometimes, and sometimes we've been doing something for a long time and it's hard to change how we eat or how we are physically active. But the most exciting, I think, is when you do see people make changes and they maintain those changes. You can really see the impact it has on their health, and particularly on their quality of life for older adults. It really has a large impact, yeah.
I think that's right. It is a change. I see it the minute you change it. You reach a certain age, your eyesight or your mobility, or why can't I walk up the stairs anymore? It's really it's not as physical as it is also emotional as well, isn't it?
Oh, absolutely.
And how do you deal with that? And what do you suggest and what do you propose to your patients?
Mental and physical health go hand in hand. So happy body, happy mind, happy body. And as we just discussed, being in community, doing things together helps it, because then you feel that you are not alone. You can talk to someone who is in the same background as you. So do it as a community, and do something which you enjoy, so that you continue doing it. And look after yourself physically, mentally, emotionally, spiritually.
Megan.
Yeah, I was going to say, and maybe try something new. I mean, I think trying something new is really important as well, because you don't really know until you try if it's something you are going to enjoy. Yeah.
Yeah, and for those online, maybe you'd like to add on to the chat what you've tried, something new, the things that you've tried that had helped you in terms of being physically active and adjusting to change. That is the most important thing. Sometimes it takes a while to adjust to change.
It does, and that's why I say, I think again, it's important to make those changes small. I think, as we talked about the 5-minute walk around the block, make them small and then and build from there. That's really important, I think, to turn it from a one-off thing you do to a real habit and something that you enjoy as well, can see benefit in. Yeah.
And as a family member who does provide support, or who has members or grandparents in the family, what can you do to help make that change?
You can show by example. So sometimes it helps, and sometimes offering them that let's do it together, let's start it together, to the family member. Say, for example, if one of my family members, say my mother, she's not into exercise, so let's start it together. I go with them, and then they get into the habit and they start liking it, and then they can do it on their own. So trying to convince them to do sometimes is tricky and hard. So talking to them, telling them the benefits. Sometimes talking doesn't work, and then you have to do by example, do with them to help them, or show them the groups or the community or the social groups which they can do, link them to that, so they can do the background work, so they can take on from there.
Yeah.
And aren't grandkids fantastic? I mean, grandkids are a great opportunity to introduce new foods, new exercise, to get their grandparents up and out in the park, kicking a ball, for example. So that's also, I think, another way. Go with the grandkids. Absolutely, yeah.
And one of the things that is important, you take your pet for a walk, or just go out and 5 minutes. I think that's really important.
A friend told me once, the important is just put your shoes on and go.
Mm.
So that message still stuck with me. Just put your shoes on and go. That's it. That's all.
And how important are the right shoes? Isn't it important as well?
Very important to have the right shoes. That's probably where the good equipment does come in. Yes.
Yeah,
Yeah.
so testing that out. There are important links on the Transcultural Mental Health line as well. We're talking about if you needed support in your language to talk about your well-being and if you're concerned about your mental health. One of the things that we find out, as I said, it's change is important. Sometimes we even as children, we are making that change of you're the ones telling the parents what to do and where to go. And it is about understanding how fragile people are as well in this age.
Yeah, doing it delicately, so is helpful. The message, it's important that the message goes in the right way, because talking and not being effective seems like a waste. So talking in a way, respectfully, that how they can do, why they should do, in simple ways. So it works.
And things like eating habits, they're very, very culturally important. So totally acknowledge it's hard to change them. And so there's also no need to change them. It might be about eating a different balance of food or eating more of some of the foods that are particularly good for people, for example, that they do enjoy. Yeah.
Yeah, and one of the things that we've done some testing and consultations for about the change that you can do and encouraging people to get vaccinated or to make that habit. It is about triggers of what's coming up ahead, like travel or an important event in your life. Is that something that could be promoted as well with the families?
Yeah. I mean, I think that's really how our coaching service works for Get Healthy as well, because the whole premise of coaching is to find out where people are at, what they want to achieve, and then help them get there and understand some of the barriers, but some of the motivators as well, to your point, what might motivate them to get there and what are the steps to get there. So, yeah, very important.
Absolutely. Adding to that, use the opportunity to convince them. Say, for example, there is a mom pregnant and the dad or the husband smokes. Use that opportunity to convince them. Look, when the baby comes, it will be useful. You stop smoking before the baby comes. So, and that works. That works. Sometimes people do for sake of others rather than themselves, for the sake of their loved ones.
Yeah.
So it works. So sometimes try to be opportunistic and use the opportunity to get the message right.
Give the Get Healthy line, as Megan would say. I think in terms of presenting the information to communities, this is a generation of information online as well, right? Where we can find all these resources online, and that could be a challenge too in trying to go in online. And how do you present that to this age group?
The word is information overload. Huh? There is a lot of information. So trying to navigate the right information can be tricky. So so that's where the younger generation can be useful. Talk to the kids. They're very useful and very quick with finding the right numbers in the right places. So, again, talk to your GP, talk to the community, talk to someone if you can't find out. Yeah.
I think that's why we offer both types of information still. So we still offer face-to-face kind of options as well as virtual, because we understand that it's not one size fits all, is it? People are going to want different options to choose from. Yeah. But definitely the intergenerational support is a bonus in this area. Yeah.
Yeah. And during Multicultural Health Week last year, we an activity was celebrate culture through movement. Every move counts. Go into traditional games that you used to do, going back into your cultural roots. Isn't that something that could be promoted?
Oh, look, culture is a really important way to enjoy what you're doing. So the group activities, the celebrations, the simple dancing, which is such a fun activity. And most of us can do one way or the other. We may not be dancers, but we can always move our arms and legs and join the troop. And it's pleasure, fun, exercise, healthy group action, good for both brain and body.
And maybe sing Megan, do you sing?
I do sing, as it happens.
Oh,
So
wow.
yeah, can highly recommend singing and just being part of those community activities that get you up, moving. Because actually, for me, physical activity is not also just about going to a class or something. It's about walking to a destination. You may be going to meet friends and you walk to meet those friends. You might be going to choir and you walk to go to choir. All of those add up as well.
5
So,
minutes of what? That walk to the
absolutely.
choir and
Yeah.
5 minutes of walk to
Yeah.
Adds up.
adds up. We've run out of time, but any last words in terms of promoting the important messages to the community and to the multicultural media online and the health workers who are online today?
Look, stick with the basics, stick with simple things. It's really easy to look after yourself. Eat healthy, eat sensibly, start with 5 minutes of exercise and get your flu vaccine tomorrow if you haven't had it yet. Thank you.
Thank you, Dr. Anju. And Megan.
Yeah, look, I would just reiterate that staying active is really the number one thing you can do that's really going to make a difference to your well-being. So look for ways to do it, and please share some of the programs and online resources that we have that can help people connect in and be more active. Thank you.
Thank you so much, Megan and Dr. Anju. And thank you so much for joining us. We have a lot of important links on the chat, but we'll also send that through email. And the recording of this session will be available on the Multicultural Health Communication Service website and also on our social media platforms. Thank you again for joining us. If you have any information you need to go to a doctor if you're feeling unwell, what Dr. Anju and Megan said, go online, contact Health Direct, and if you need language support, call 131-450 and be connected to Health Direct if you need any support. But for now, get vaccinated, as Dr. Anju said, get healthy, get active, sing and dance if you can, and the 5-minute rule, just start doing it. Thank you very much. Have a lovely afternoon.